All right, so a newborn abdominal assessment is relatively similar to that of adult as well. One thing that you want to keep in mind is that babies like to move around a lot, and they don't always relax when you want them to. So a little trick is that you can kind of hold their knees up with your non-dominant hand, kind of like that. And that relaxes their abdomen. And as you are going through palpating, that helps keep things a little bit relaxed so that you can feel. So you're going to first inspect the abdomen, see if you notice anything. Sometimes there is a linea nigra, which you might see, which is a hyperpigmented vertical line from the umbilical area to the pubic symphysis. So, the pubic area. And usually this will resolve with time, but that's something that you might notice. You also want to look to see if their belly is flat, is their belly rounded, is there a distension? Those kind of things are important to note. And then you would want to palpate and feel around. So you're going to feel their abdomen the same way you would with an adult. And you're going to feel if there's any masses or anything that doesn't feel where it should be. You also should be able to palpate the liver like you would in an adult. And then you want to listen. And it's exactly the same as an adult. You're going to listen in the 4 quadrants. You want to make sure that you can hear vowel sounds in all 4 quadrants. So that's something that we're going to do now. So we're going to listen. You want to make sure that you hear vowel sounds, and they can be hypoactive, they can be normative, they can be hyperactive, or they could be not present. So those are things that you just would want to pay attention to. One thing with a newborn abdominal assessment that is different than an adult is that newborns typically still have their umbilical cord attached, especially if they are very freshly born. It is typically clamped, and you sometimes can feel the pulse in it, which is kind of neat. One thing you do want to do is check the end and see if you can see the 2 arteries and the 1 vein. There's usually 3 that you'll find, 3 separate places so the 2 arteries and the 1 vein that you'll find, and you want to make sure they're there. If there is only 1 artery, sometimes that can mean that there is something more going on, and that might be something that you need to look into. So you just definitely do want to check it. As the umbilical cord days go on, it dries, and eventually that will fall off, and the baby will be left just with their belly button. So that's something. Sometimes babies can also get umbilical hernias, so after the cord falls off, it's something that you could notice, and that would just be, you would see that the belly button's kind of raised, and if it's reducible, it means that you could push that back in, and if it's not reducible, it means you can't push it back in. And a hernia is when the abdominal contents, the intestines, kind of push through a little hole in the wall, and that's kind of through how you feel them in the umbilical cord. And it's kind of like a little mound, but when you push it, it goes right back where it's supposed to go, and that means it's reducible. So there you go.